In this training video, we're going to provide an overview of the patient portal. Now, this is such a helpful thing to a clinic. It allows for communication, secure communication with patients. It can also help the clinic save time, allowing patients to fill out intake forms in advance and do so much more. Now, to start off this process, oftentimes where we'll begin is within the patient demographic record. I'm going to open up a sample patient here that we have in our system and just show you how that's enabled. We're going to work with Joe Blink here. And once we open up that patient's demographic, one thing that is needed is the patient's email address. So we'll want to make sure we have that email address listed in the appropriate area here in the demographics. Now, what you're going to notice once you've put that in and saved it, up above here we have a circle that really pertains to the patient portal. Now, if we have not initiated the patient portal for a patient as of yet, this circle will likely be red to indicate that. But once it is set up, you should see it showing green, and at any time we can hover over this button. It's going to tell us some more information on the status as well. Now, if this is a brand new patient, or even maybe someone who's just called in over the phone, one nice thing that you can do right off the bat is grab that person's email address, create their demographic account, and then let them know right away they're going to get access to this patient portal. Of course, we can enable this for existing patients as well, clicking that same button. And what we're going to essentially do is check this checkbox here to activate the patient portal login. Thereafter, we're going to see the email address that's recorded for this patient. We can confirm that. But below here, we're going to want to check these checkboxes for a welcome message and an activation code. And that's actually going to send 2 emails to this email address we have on file for that patient. Now, I can't check these right now because this patient's already active in the portal. But again, if this is a new patient or someone that does not have portal access currently, we'll be able to check those. And then we could hit this email button, and that patient will receive those 2 emails with the instructions to get set up. Now, it's worth noting that the email that goes out, those can be completely customizable, configurable. So we can adapt that language, provide any instructions that we need to be able to help that patient along. I'm going to click done here, just showing you now that essentially when this is green, we'll know that this patient portal is active for use. Now, it is worth noting, in addition to enabling a patient one by coming into their demographics, it is also possible to direct patients to the portal website, and they're allowed to create a new account essentially on their own. When they create an account through those means, it essentially comes back to the clinic through the dashboard, and that can be approved or denied by users like Front Desk. And then that kind of setup may be less common, but it could be useful if you're trying to promote the portal through a marketing campaign, email marketing, trying to get many onboarded at once. So just know that that's an available feature as well. Now, something else we want to draw attention to is some other things we can do within the patient's chart since we're on the health record side. If we go into Joe here again, something the doctors can do once they've completed a note, and we're going to just open up an existing note here. We'll select this more recent one. When a doctor is working on a note or completes it, you notice there's a checkbox at the bottom to show on portal. So when that's checked and saved, that will actually be available for the patient within the portal. So just note that that note can show up. One other thing that's worth noting is the communication you can have with patients from the health record side. So what you're going to want to do to enable that is go into your dashboard, and you're going to find, especially in the provider dashboard, the flag area, which is essentially like sending messages. As you may know, you can send messages to internal staff, but you can also securely send messages to patients using this method. So as an example, when we're in here, we can click this plus button to add a new flag. And what we're going to do here is we're going to check this checkbox to send to patient. And we can start typing in part of that patient's name to refer to them. And you're going to notice now it references that patient here and in the to section. And this will actually send this message to the patient through their portal. So we could start typing in a message. and you'll notice it actually completes the subject as well as we fill this out. But we can make any adjustments as we need to and hit OK. And that will essentially send that message to the patient's portal. And we'll look at that here in just a minute. Now, before we see what that looks like on the patient side, looking at their portal, we're just going to show you some of the configuration options on the clinic side, what you can do to customize the portal. I'm going to close out of our dashboard here, and I've actually got a sign in ready to go here. And you're going to notice from the patient portal, there is a link here to log in as administrator. And when connecting in from the clinic perspective, that's essentially what you're going to do. So you're going to have a login and be able to go into the administrative side of the patient portal. Now, once you're in here, you're going to see some things that are available for you to do. Off on the left-hand side, these are the available forms or categories that can be made available on the patient side, what they're going to see. And we can simply drag over into these different boxes what we want the patient to have available to them. And you're going to notice there's X's at the corner of each of these little sections if we want to remove something we don't want the patient to have access to. You'll notice some of these windows too are also bigger or larger, and some are smaller, and we can move these around as we see fit. So for example, maybe we want virtual visits to be here, but maybe we want vital signs to show larger. In this case, we can remove virtual visits and vital signs, and you're going to see now they're available at the left-hand side when they're white. We can click and drag those into the appropriate spot as we want to, and move those around. And of course, we can use other ones as well off to the left-hand side, dragging those into the areas as we like. So we can set that as we need to. That's really what this first area is. It's the dashboard. If you get away from this, you can always click this button to get back. Some other things you can configure from the clinic side is this second button over to manage the home page. So when a patient goes or navigates to the patient portal, you can configure the pictures or images they will see. Maybe you want your clinic's logo or other similar images. You can also adjust some of the text on that patient portal website. Additionally, on the patient portal, there are images that are displayed that can be hyperlinks. So the patient could click on the image and actually be brought to a different website. So if there's maybe a clinic website you'd like the patient to have access to, or some other website, you could make that available to click on by customizing this particular area here. There's a few other things oftentimes we would go over with you. So there's some further settings to be able to configure in the system, terms and conditions, and some other information up above too. But I'm going to close out of the clinic side, and we're going to sign in and see what the patient side is going to look like, what a patient see. As a reminder, that patient is going to get those two emails, a welcome email and an activation email. So they're going to get the information needed to be able to sign in to find this website and sign in with a username and password. So we have that here for this patient, Joe Blink, and we'll log in with their account. Okay, you'll notice we do have an appointment for this patient today, so it's kind of nice they got front and center a big reminder, and they could even check in if needed. You'll notice this is laid out just like we had set up on the clinic side, so the available windows are showing as we had configured. We sent that secure message a little earlier, and so those secure messages will show up in this particular window. You can see there's the test message that we just sent. This patient can respond. You'll notice they can reply with that message. That will go back to the clinic, and they can work with their other messages here if they want to remove them, draft up, or send other messages. So just know that the patient has that two-way communication option. And now we'll go back to the dashboard. So as you no doubt could probably figure out, as you can click on a number of these different sections here. You could complete vital signs if the patient wanted to work on their vital signs. Hit this plus button, and the patient could record their own vital signs. The EHR will differentiate between vital signs the clinic has recorded and what the patient has recorded. You'll notice also there's an appointment section, so you could see various appointments, or the patient could see that. you could actually allow the patient to schedule their own appointments. This can be a feature that's turned on or off, but as you could see, the workflow would allow the patient to choose what they want to do, an office visit or telehealth, and next their way through, completing the date, location, provider, time, and so on. And they could confirm an appointment right from their patient portal. Again, that's something we can enable or disable from the clinic side. We also have other things that can be done, like prescription refills, clinical alerts can display in this area, and billing statements can display here as well. Now, one thing we wanted to draw attention to is the different forms that could be completed by a patient. This could really save the clinic time, allowing the patient to do this in advance, and the provider can even bring in some of that data into their note using the copy previous feature. So for example, we have this forms section we had added down below. That's where scoring forms could be entered or added in. You'll notice up above in this area here, we have patient intake forms. We'll show you that here in just a second, but maybe we'll focus on consent forms for just a minute. And you'll notice the different forms the patient could complete in advance, a HIPAA consent form, financial, and so on. So if we go down and hit this little pencil icon here to show a list of these forms, you can see one that's already been filled out and signed, this HIPAA consent form. We can actually complete other forms here too, though. If we go to financial policy, we could, as a patient, indicate we've reviewed the form and hit next. And you'll notice here, again, here we have an insurance assignment form. We could say we've reviewed and hit sign. And this allows the patient to actually sign this form using their computer. You'll notice there's an electronic signature area. So we could put in Mr. Joe Blinken's signature, fill out this other information as we desire, and hit continue. All right, so we'll notice that this patient now has a signed additional form. So that's something we could provide direction to the patient in our welcome email if that's something we wanted them to do in advance. And you can see all of these are now green, signifying that those have been completed. But now let's go up to this patient intake form area. That can be really helpful to be able to fill out other forms in advance. Let's hit this plus button. We can show you what that looks like. So first of all, the patient can confirm their details or enter in more of their demographic data if needed. They could even supply their own picture. We'll go next here, assuming everything looks good. At this point, the patient will want to select an appointment date to connect their intake forms to. We'll select a date for tomorrow, and then they could actually check the appropriate checkboxes for the intake forms that they should fill out. Again, we could communicate that to them through an email or, of course, through a secure message into the portal. If it's a new patient, the welcome email may direct them to check certain checkboxes or most of them. In this case, we'll just pick one and be able to continue with the process here just to show you what it looks like. Okay, once this area loads, we can fill out some information here. We could go through and essentially check the information that's applicable as if we were the patient, of course, filling out what is necessary. And I'm going to scroll through the bottom, just choosing a couple items just to show you what this looks like. So now this patient has filled out some of their history here, and they can hit the submit button once they're completed at the top. Now what's nice from a clinic standpoint, as a provider, if we go back in on the iPatient Care health record side on a computer and actually open this patient's chart, we're going to be able to find that that information is carried over and even can be used by the provider, especially using the copy previous feature to pull that into a new note. So we'll just pick a new note as if we're filling out a new examination here. Okay, and using the button up above, we have the copy previous, what we can select. And you're going to notice now these intake forms that the patients have filled out, we can bring in data from those forms. So when a patient fills out a form, we can check the appropriate checkboxes for the data we want to bring in. We could hit select all if we wanted to bring all of the data in from the patient's intake form. And then that's going to bring that information right into our note, just like the patient had filled out. So that could certainly save us time. Well, we hope this training video has been helpful to show you the health record side, the patient side, and how we can tweak some of the settings to be able to get that patient portal up and running and certainly useful to your clinic. Thanks so much for watching.